This interesting case demonstrates our ability to improve cosmetic and surgical results in patients with severe trauma. Almost 15 years ago, I repaired this iris coloboma in this patient who then moved from the area and recently noted with the development of a cataract and enlarging of her human lens that the sutures started to cheese wire as the anterior chamber shallowed and this lens swelled. There was an area of zonulolysis where the coloboma had occurred. However, she was relatively young, in her 40s, and it was a soft cataract. Even though there was zonulolysis, it was not an issue to remove this lens by phacoemulsification. And here we use a little visco dissection to get the cortex up off the capsule so we don't have to pull too much on the zonules. And this is prior to my common use of capsular tension rings, which I didn't think was really needed in this case and we didn't routinely have. Here I'm using Whitman to remove the anterior endothelial epithelial cells on the posterior surface of the capsule, and then placing a crystal lens in this case, which I thought would be good to not only give this young patient some accommodation in her aphakic eye, but I could orient it so as to better support the area of zonulolysis, placing the haptics in that meridian. Here I carefully engage the proximal end at the pigmentary rough, drive it in through a cannula to drive it through the iris, remove it from the eye, and carefully reconstruct a normal pupillary aperture. This procedure was eased because the patient had had a stretched iris previously, and you can always add more sutures and stretch the iris after 6 months if you need additional closure. This is somewhat akin to people who put those rings in their ears and slowly enlarge the opening. So by stretching the iris and then waiting, and here we're closing the peripheral dialysis and also centering the pupil more carefully using a small conjunctival flap and tying that externally to move the pupil into a more cosmetic central area. This procedure is easily completed. Here I'm stretching areas where I think I either overcorrected or need to be sure the iris is well aligned. Here breaking some synechii and pulling the iris in the periphery to center it more accurately. Once that's completed, it's just like cataract surgery. I do the Siepser test, make sure that it's white watertight, and this is a completed procedure and repair of an iris defect.